So the next section we're going to talk about is really the old way. We're going to dig deeper into the state of the union and what we have, and like we've talked about the importance of doing it, but really dig deeper into the unique challenges of our current protocols, recommendations, which we believe are rooted in this old historic way we've managed it, which we are debating may not be the most optimal way, likely not the most optimal way. So why don't you take it away from here?
So, we talked about the way that we screen, but what's very confusing, especially as a healthcare provider, is that there are standards and recommendations that we are presented with from different unified bodies, right? So, U.S. Preventative Task Force, American Cancer Society, CDC. So all these organizations.
The American College of fill in the blank.
Right. And those are just the U.S.-based ones. I mean, there's ones in Europe. They have their own screening guidelines.
Oh, yeah.
So, not only do we have discrepancies between the societies within the U.S., but then you bring in other countries as well. Internationally, right. And so what can be hard is, I pulled off from just for breast cancer screening. There are 4 different organizations on this sheet, and every recommendation for mammography is different. Some start before age 50, but that has to be decided by the patient. I'm sorry, what? So I have to tell my healthcare provider when I want a mammogram.
And by the way, does anybody tell the insurance? So that's
right.
Wonderful.
Yeah.
But what if your Blue Cross Blue Shield decides that you don't need it?
Yeah. And then every duration between screening is different. So some organizations say every 2 years, some say every year. Some say do it annually for women over 40 years. Some say we need to start at 50. So, if you're in that age group before age 40 and you have a super strong history of breast cancer, you better be getting a mammogram, even if insurance doesn't pay for it.
Yes.
Because you could find something. So, just a rant on my behalf of, and then self-breast exams. I was always taught in school, teach your women to do self-breast exams. All of these organizations say it's either optional or shouldn't be taught. If I find something suspect, I probably want to check that out.
As an aside, my wife is alive twice.
Yes.
From her self-examination. She found both the primary and the recurrence on self-exam.
Yeah.
And by the way, she's had it twice, survived. She's not 40.
Right. And she had the most aggressive form.
She'd be dead.
Yeah, she would be dead.
Somewhere between a year or 2 delay in her cancer, and she probably would already not be with us.
Yeah.
It's staggering to me that on average, just continuing this rant on breast cancer because it hits home.
Yeah.
There are so many women who are suffering from this, and yet on average the recommendation is don't do it under 40.
Right.
Meanwhile, all around me, and I know this is anecdotal and my eyes are on it, so I'm biased towards seeing it, but I'm seeing women in their mid-30s having horrible outcomes.
Yeah.
And families now that don't have a mom before the age of 40. I mean, we have got to look at this closer.
Right.
For the sake of moving this conversation along and not just making this about breast cancer, but breast cancer is the most common cancer in women. This is a major, major deal. And when the most common cancer in 50% of the population, women, the recommendations are this confusing.
Conflicting.
What in the world are we doing?
Yeah.
Anyhow, I think it's important to, thank goodness we have mammograms. Thank goodness we have ultrasounds. Thank goodness we have pap smears, and we have tools to capture early screening and early detection for some cancers. But you and I were both stunned as we began to dig into this that 7 out of 10 cancers do not have screening. We don't have the capacity to screen for these cancers. from the CDC in 2020. We already talked about lung cancer being the most deadly cancer of all. 23% of all cancer deaths come from lung cancer. Mm-hmm. Now, some people can get a screening CAT scan, but very few people are utilizing it, and it certainly is not being mainstream pushed, encouraged. Listen, lung cancer has... So colon cancer is the number 2 cancer killer behind lung. Mm-hmm. There are 2.5 times more deaths every year from lung cancer than there are colon cancer. And thank goodness we have colonoscopy. It does a great job. Recommendations now have moved it up to 45. I'm very proud of that process.
Yeah.
I always felt like 50 was a little late. Mm-hmm. But 2.5 times the number 2 killer is the number 1 killer, where we don't have any regular standardized early screening, early mm-hmm. detection. Lung cancer is a killer. And
you're probably only going to grab that CAT scan on a former smoker.
Heavy smoker.
People die from lung cancer that do not smoke.
Yes. Pancreatic cancer. 8% of all cancer deaths are pancreatic cancer. Mm. 0 screening. Yeah. Ovarian cancer. 5%. Sorry, not ovarian. Liver cancer. 5% mm-hmm. of all cancer deaths are liver and biliary tract cancers. 0 screening. Ovarian, I'm not sure what the percentages are, but it's horribly mm-hmm. high mortality rates. The point is that 7 out of 10 cancers that people die from, we don't have any screening tests. We are a reactionary system, a sick care system that only responds once someone has symptoms. Well, let me tell you, if you have symptoms as a consequence of a cancer, it's not going to be good.
Yeah, it's already too late.
It's likely too late, mm-hmm. which is a sad tale, which is no wonder we're so terrified of this thing.
Yeah.
I just went to the doctor last year. They said everything was fine. 6 months later, they say I've got 6 months to live because there's cancer. That cancer didn't just show up. Mm-hmm. We have got to do better.
Yeah.
Jen, just as we wrap up this section, talk about the regular screenings that we do have in place, even if you wanted to spend a little more time on breast, mm-hmm. Some of those things.
Sure. For women, really important to get your mammograms. Again, the guidelines say start at age 40, but if you have a strong family history, I would definitely start that
10
years prior.
From the earliest diagnosis,
mm-hmm.
absolutely.
Yep. And even if insurance doesn't pay for it, strongly consider doing that. Yeah. I've talked to many women that are terrified of mammograms. It's nothing to be terrified of. And if you have a great technician, they'll walk you through mm-hmm. your very first one, and you'll be smooth sailing after that. They have great imaging technology now with 3D mammograms. That's the only one I get now, which can show much more detail of the breast
That's
tissue. Right. So be asking for that. Cervical cancer, again, your pap smear, get that from your...
With reflex HPV.
Mm-hmm. Yep.
So talk to your OBGYN or your family doc, whoever's doing these annual exams for you.
Yep. Prostate cancer for men, again, you touched on it, an annual PSA, which is a blood test. Mm-hmm. And then if the level is above a 4, is that what we go by now?
Yeah, well, according to population health,
yeah,
it can't be prostate cancer unless your PSA is over 4, which is garbage. Mm-hmm. But nonetheless, it's going to be hard to do anything beyond getting a PSA mm-hmm. unless it's over 4. We have found dozens and dozens and dozens and dozens of early prostate cancers.
We have.
Well below a PSA of 4.
Mm-hmm.
But that is the recommendation. But at minimum, guys over 50, absolutely. I would encourage anybody over 40, and same thing with breast. Mm-hmm. So prostate to men is like breast to women. I mean, it is the most common cancer in men. If you have a positive family history of prostate cancer, it tends to really run strong in families. I mean,
mm-hmm.
if there's a strong family history of guys in your family having prostate cancer, 10 years prior to the earliest guy you can find that got diagnosed. So if somebody got diagnosed at 46, at 36, you better be getting annual PSAs and watching that like a hawk
mm-hmm. for
any variation, the rate of rise.
Yeah. Yeah.
How quickly is it rising? Not necessarily how high is it.
Mm-hmm.
And this isn't about prostate cancer, but that is a subtlety.
Mm-hmm.
But you're not going to see that data unless you're tracking it.
Right.
And then colon, right? We've talked about colon.
Colonoscopies.
Men and women. 45 now.
Yeah, 45. Yep, I'm behind.
Or 10 years. Me too. By 2 years.
I know.
You know, it's hard to march out. Like this just changed a couple years ago. It was 50 forever. My father had an upper GI cancer. And it has been highly on my radar to do before the recommendation. I thought I was doing really good because I was going to do it by like 45. And then the recommendation became 45. And then COVID happened and we've kind of blinked and 2 years have gone by and so whatever. But yeah.
You do bring up a good point about the pandemic. There's plenty of people that have delayed or
oh my gosh.
You know, couldn't get in for their screening tests.
We're
sure
over
you
2 years
schedule
out
those.
now
Yeah. Get
of
on the books.
world changing and people keep waiting for it to go back to normal. Ladies and gentlemen, this is the new normal.
Yeah.
Like whatever has been put off, it's time to do it.
Yeah.
Because your future depends on it in a lot of ways. So just to recap this section, there's 0 screening tests or surveillance protocols, no standard of care for massive killers like lung, pancreatic, ovarian. We've got to do better.